Hello, lovelies. How are you doing today on the BirthLink podcast? Welcome. Man, I just had a really busy week last week. I worked 3 shifts at the hospital and full time. No, it was just 1 week of full time. I usually work just 1 shift a week. I went to per diem, so it's 1 shift. Part-time's 2 shifts. So 12 hours. Honestly, that's so doable. I get my time at the bedside and I love it. And then I get the rest of the time to work on My Friend's a Nurse, which is really where my passion is at this point, along with this podcast and everything that goes along with it. So this week I did some research on the golden hour. A lot of it was stuff I already knew, but then the more I looked into it, the more I was like, geez, like this we kind of maybe we over pushed the golden hour. We're not educating both sides. And I'm all about that, right? To make a proper decision and a choice, even if it's something as biological and basic as I want to be with my baby after birth, it's still something that we want to look into, because when we don't get things, we may feel cheated or even have guilt. And I'm going to go into it today about this golden hour. Totally part of the first 15 series, because it's going to be a decision and choice that happens right after birth, whether it's a C-section or whatnot. But it doesn't mean that it's has to happen in those first 15 minutes, right? It's just something that we need to discuss with our partners, our healthcare team, and our providers before we deliver. So you have an understanding of it and you're not making that decision at the time of. But if you do, you do. It's okay. But nowadays, we're just going to push that golden hour, and then we push and push and push, and then you can't have it, maybe for a medical reason, and then we don't give much explanation or help afterwards on that transition and what it looks like, and how you're feeling when you don't. Like, you guys pushed this so much, and then I couldn't have it. And now what? Like, I feel like crap. Like, what did I do wrong? I failed my baby. That sucks. I don't want anyone to feel like that. So that's what we're going to get into today. And I'm pretty excited about it. It kind of opened my eyes a bit too. So I hope it opens your eyes and makes you think both ways. Message me if it did, or if you have any questions. Okay. You can find me on Instagram at My Friend's a Nurse and send me a DM. Tell me what you thought. I love it. I love it. I love it. And if you'd like to work with me, of course, you can message me at Colette at myfriendsandnurse.com, COLETTE. And I would love to maybe have a discovery call and see if we'd be a right fit. If you'd like to have me as your nurse coach, I will walk you through pregnancy, birth, and postpartum with your baby. I can work with you for the whole year. I give a really good discount if you want to work with me for the whole year, and give you all these gifts and freebies and fun stuff. And honestly, we're going to become friends, because that's just how it's been. But I love it. So let's get into it. This is actually a long episode. I told my producer, like, next week is on the golden hour, so it'll be short. Oops. Sorry, I should never say that, because it's already it's going to be about an hour. But I love it, and it's good. I think it's a really good one, and I really hope you enjoy it, all right? Thanks. Welcome to the BirthLink podcast, presented by My Friend's a Nurse. I'm your host, Colette McCullicher, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of 2 beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. Welcome back to the first 15 series of the BirthLink. All right, today I want to get into that beautiful time immediately after your baby is born. That time that you want to bond and connect, literally skin to skin with your baby. And as a new family, as a new mother, right? And I'm adding this into the first 15 because it's something that should be thought about and discussed not only with your birth team and your family members who want to visit, but also with yourself and your partner. Kind of dive really deep into what that time looks like. What is your dream of it? What would you like it to be? And really understand it because you want to relieve any shame or guilt or like unrelenting disappointment if you're not able to get it right away, right? Knowledge is power. And I really, really hope that this episode helps you with that, right? It means taking the time to imagine what it's going to look like and anticipating the whirlwind of emotions and feelings and the unknown physical and mental challenges that go along with labor and, of course, birth, right? Honestly, the more I've learned about like what we call the golden hour, the more I'm sort of resenting the whole name of it, like, and the standardization of it, right, as a policy. It almost takes away what it's truly meant to be, and it makes it even harder on moms who then don't receive it, right? But I'll get into that a little bit later. So right now, let's get into common practice of it, right? The hospitals actually make this more of a policy now to allow for a golden hour. We call it the golden hour, and it's been pushed since I've started, so maybe 7, 8 years ago. So maybe it's been like 10 years that literally they're like policies around US around this with that term, the golden hour. And they're so proud of themselves, of ourselves for calling it this and for giving this to moms. Like it's this magical thing that we're handing over to you. Like, here, you can have your baby for an hour. I'm like, oh, thank you so much. Anyways, it's literally like timed 60 minutes sometimes after birth. Like, okay, it's been an hour. Give me your baby so I can do all these things to her now. Right. It's all about waiting on those unnecessary interventions. I mean, they're necessary, but they're not necessary in the first hour, where we have to take the baby physically away from moms to do things that aren't medically urgent, right? So like weighing the baby, doing her measurements, maybe some medications, which can be done on mom, and complete like a full assessment. We need to lay the baby down and really check her back and her fronts and her eyes and her head and, you know, all the things that we really can't do while she's snuggled up with you. And yeah, medications we can do on her, but many of the times we want to wait and do them when we have them under the warmer. We can see them and it's a little safer, right? But even the medications, vital signs, some quick assessments, you know, just to make sure that they're breathing and their colors are good, lung sounds are good, and just to make sure they're transitioning well, can all be done on mom, right? So even though it's become more standard, there's still some old school nurses who are, you know, stuck in their ways, and they're on this tight to-do list schedule, and they see no issue with taking your baby for 15 minutes to get it all done, right? With not a lot of conversation from you, just like, is it okay if I take the baby now? Thank you. And they'll go ahead and do what they need to do. I still see it to this day. And it's a little bit of, it has to be a discussion, and they really need to ask you, right? Or you need to stand up for yourself and say, no, not yet. Can we wait an hour? Hello. And then they usually will. They'll just huff and puff and walk out and come back when they can. But you know, it's because we understand the benefits of it and we support it. We want to support you being with your baby. I think that's like obvious to me anyways, but and probably to you, right? So your nurse will be able to quietly and respectfully work around you. So she'll check your bleeding, she'll make sure your uterus is firm, she'll make sure the baby is transitioning appropriately by taking of vital signs while on your chest. Right? Some mothers may want to start breastfeeding during this time right away. And others would rather have their family come visit, come in and see the new baby. They want to share this baby. It's different. Every culture and person and family is unique and different, right? And we want to respect that, even if it maybe isn't part of our standard golden hour where things are quiet and you're not disturbed and you're skin to skin. But maybe you're just like, dude, I want my family to come in. I've seen that many times, right? But at the very least, the medical staff are going to do their best to stay back and allow this precious time, you know, when possible. And I'll go more in at the end of the episode on what you may want to think about and include in your birth plan, and why the golden hour may start before you give birth, and how you can maintain that level of bonding much longer than an hour, and even with visitors present, right? So let's discuss for a minute what exactly is meant by this term, the golden hour in the hospital, right? It's the time immediately following birth, known as a golden hour, when it comes to mother and baby bonding, right? We will include dad when mom is not able to or is not asking to. So we do find it to be very valuable as a family unit, but the most benefits will occur when it's skin to skin, mom and baby, just for those hormones as you're adjusting, for reducing bleeding. Some benefits for mom happen and occur when the baby is with mom. That's where the baby's coming out. That baby is used to mom's heartbeat, mom's smell, mom's voice. So to ease that transition to be next to mom is key, right? But if we're not able to, or then go to dad. They know dad's voice, right? A heartbeat is a heartbeat, and warmth is warmth. To keep that baby's temperature in check is all really wonderful. So during the period, skin-to-skin contact between mother and baby used to promote attachment, reduce stress, both for the mother and baby, and to help the baby adapt outside of the womb, just like I said. So there should be no clothing or blankets in the way for proper skin to skin. Perhaps you can put a hat on the head. I think a lot of hospitals just do that automatically. Evidence shows it's really not necessary, that a blanket is fine. So that's up to you if you want a hat, just depending on how wet the baby's head is. I never understand putting a hat on a wet head. You want to dry it a little bit first, and then maybe the head's a little swollen or I don't know, roughed up after coming out of the vaginal canal, and maybe a hat on the head isn't the most comfortable thing. I don't know. It's up to you. But the Center of Disease Control and Prevention recommends the practice to promote breastfeeding, and it's been endorsed by medical groups such as the American Academy of Pediatrics and the World Health Organization. So let's get into really the specifics of the evidence and what it shows, what the benefits include, so that we have a good evidence-based discussion around this first to promote this golden hour, right? So hormones, right? Skin to skin contact releases and regulates hormones that help with bonding and can reduce stress, bleeding, and even pain, right? This is due to the release of oxytocin, which we know has that amazing overall effect of all of those things. It's going to help our uterus clamp down. It's going to help our, feel good. That's feel good hormone, right? That's what we call it. So it's going to help reduce that pain and stress and just make us feel really good when we're looking at our baby right in our arms. We deserve that after all that time of carrying this baby and having this pregnancy and then birthing her. We're just going to feel just this beautiful surge of oxytocin, right? It's also going to help babies' regulation of their heart rate, respiratory rate, and blood sugar levels. All right, so when they're next to mom, their stress levels will be minimal and they'll feel so much more comfort, which will allow everything else to be regulated, like their heart rate and their breathing and cortisol levels, and then their sugar levels, right? Because they're not using so much sugar to breathe really fast and their heart rates if they're crying a lot, right? Which also goes into reducing their crying, which is amazing. And that's what we want. It also increases the benefits of breastfeeding. So that does show that when we use that skin to skin, especially in that first hour, a increase in breastfeeding effectiveness. Like you're able to breastfeed. Moms were able to breastfeed longer and successfully when they had that golden hour. It probably because it produces colostrum production because of that oxytocin, I suppose. Postpartum recoveries, right? So like we said, it's going to reduce postpartum bleeding and decrease the risk of postpartum depression and anxiety. That's what the evidence is showing. And then weight gain. So skin to skin contact is going to help the baby gain weight for all of the reasons that we had mentioned, right? Decrease in cortisol, increase in breastfeeding successfulness. Is that a word? And yeah, so research that shows it, and like I said, it's going to decrease the baby's crying, and it's going to be able to develop better sleep patterns, which all new parents want and love, right? So great benefits there. That's what they show, and it's even actually more beneficial for these very vulnerable babies that end up maybe like deliver preterm, and they end up in NICU. A lot of the research that I found actually comes out of the neonatal intensive care units. So that's where they did a lot of these studies and trials, where through their findings of holding preterm babies against parents' chests, and how that can help regulate the baby's heart rates and their breathing and their ability to gain weight and even more. So this is called kangaroo care in NICU, and it can be done successfully with your baby's healthcare team, even for those that need breathing and feeding tubes, and they're very, very vulnerable. The more vulnerable, the more you're going to have to push to get it done and advocate for yourself. I think I want to just give her a shout out, or them a shout out, at the NICU doula on social media. Love her. And that's where I first learned about how to advocate for yourself when your baby and for your baby when they're in the NICU. And especially if they're very preterm or very sick, and they're going to be hesitant on, changing their location from the bassinet, from their incubator to, is it called incubator? Oh my gosh. I know research here. Anyways, from the baby to your chest, skin to skin, it's not going to be an easy feat, but man, the benefits just are amazing. And so really look into that. Follow her in the NICU doula. I think that's what it's called. And get that information so that you can advocate for yourself if that does happen. All right. So to make the golden hour as interrupted as possible, it's recommended to minimize exams and measurements. It's also important to limit your visitors, because it's very hard to focus on baby and yourself and that time, and to be quiet and start breastfeeding when, it's harder to be exposed or focus. And as people come in, they want to hold your baby. They want to, coo over them. Was that a word? Coo, him and hot? No, forget it. I don't know why I'm trying to start using these kinds of words that I never use. Him and hot. Whatever. That's totally opposite of what I meant. But anyways, you will notice that the staff, anyways, maybe we don't have much control over who you want in your room, but the staff are going to clear out of your room pretty quickly after delivery. And you'll probably have your nurse, maybe another nurse, or a scrub tech or someone in there helping out to just clean everything up, and then out of the room as well. And your nurse will start just coming in and checking on you every 15 minutes just to check your and your baby's vital signs, your bleeding, and then your pain. So she'll be doing that. So we can't it's not totally uninterrupted, but it's the best we can, right? You can ask if she hasn't to dim the lights and just keep talking to a minimum. And you'll just notice that kind of happen naturally as we've moved into the more standard golden hour care, right? And then remember that your partners or your birth coach or your family can also participate in the golden hour. So that's going to help strengthen the family bond, right? They'll be able to be there, loving on you, taking care of you, maybe giving you a sandwich or something to eat because you're probably hungry, or taking over if you're just too tired. And I'm going to go deep into that actually in just a minute. Okay, one more time, benefits. Benefits for mom: reduces postpartum bleeding, increases both breast milk supply and breastfeeding success rates, decreases the risk of postpartum depression, anxiety, and mood disorders. Using bonding of smell, touch, and sounds to increase that oxytocin supply, right? Benefits for your baby: improved weight gain, more stable breathing and heart rate, regulating the breathing and blood sugar, higher oxygen levels, better breastfeeding, and long-term development and attachment benefits. All right. So then you're going to wonder, of course, what happens after a C-section? What if I need a C-section? This is all great, but can I still get that skin to skin? Can I still have that golden hour, right? It's not going to look the same. It's just not, for as a standard as we have it now, we're a little bit behind, or we can do what we can. It's as a whole, which we will try to accommodate skin to skin in the OR. We'll definitely try. But especially if you're adamant about it, like you are letting us know, I want to do skin to skin, or even I want a gentle cesarean. Look into that and speak with your physician if you're interested in that. But if you have that on your birth plan and you're talking to us about it, you are more likely going to get it than if you don't say anything, because as of now, it is not a standard of care in the OR to give you skin to skin and get that golden hour, because honestly, you're not comfortable. You are laying flat while we are sewing you back up and cleaning you. It's still a little hectic. It can be. Usually, after delivery, things calm down if you can be skin to skin. And it just depends on how you're feeling, what your anxiety level was. And if you got medications, you tend to get really, really sleepy after your birth in a cesarean. So it just depends. And because of that, it isn't like so standard that we're going to throw the baby on your chest, skin to skin. We're usually going to take them from the baby warmer, where we help them transition, swallow her up, and bring her over to you to just kind of kiss her and meet her and see her little chubby cheeks and whatever the case. And then maybe dad will hold her, or dad and your nurse will take her to recovery while you sleep and get all cleaned up. And then you'll meet her in recovery room, right? So yes, there are certain steps that your care team must take after cesarean section. That is to ensure the safety and health of both you and your baby, right? This is an invasive surgery that we take very seriously. And in many cases, there may be quite a delay before that skin to skin contact can begin, right? Especially if your baby has to go to the NICU. Right? And you're in 2 hours of recovery, and then maybe you get wheeled over to NICU and you get to see her and hold her hand, but then we have to take you to postpartum and get you all sorted. And, it may be 6 hours, 8 hours until you're up and in NICU able to hold her. And some moms take even longer than that, just depending on how well your baby's doing and how accommodating the NICU staff is. And that can be heartbreaking. Okay, so I understand that, and we're really not going to get into too much to that today, but just know that my heart is with you, and we totally understand as mothers and as people and caregivers that it's truly heartbreaking, and you really need to advocate and stand up for yourself to get that. And sometimes when you fight for it and you still don't get it, it is even more crushing. So just know that I'm with you on this. And we're doing the best we can as we grow as people in a medical healthcare system. And it's tough. I know it's tough, right? But most times we will be able to begin your bonding in the recovery room as soon as you feel able to, right? Let me scroll through, since I just kind of went off on the whole NICU thing, because it is crushing, right? It can be disappointing for parents who want to participate in that golden hour they heard all about. Golden hour, especially with birth educators, even myself discussing it, right? But at the end of the day, we know that the safety of your newborn is priority. Or of yours. If you're having a postpartum hemorrhage, if something's happening to you, we need to take care of you. And that is not the time for you to be bonding with your baby. And maybe your baby's perfectly fine, and a family member or your partner can take over until we get you stable. But it's very, very hard. Even though as a mother, you logically know this and you understand it, that doesn't take away the disappointment, or worse, like guilt or shame or grief of losing that precious time that your body like physically and biologically needs. It's more than just like what you've heard about or were taught about or what our policy is. Okay. It's this instinctual feeling of needing to be close to your baby during that time that many, many women feel, right? It's a natural feeling to be like, where is my baby? And maybe this doesn't happen immediately. Maybe it takes a couple of hours and your baby's in NICU and then you're like, where's my baby? I need to be with my baby. That is biological. This is not something that can be taught. I mean, it can be taught, but the feeling of it and the desire to have it goes way beyond like, oh, I read in the book that I need to have golden hour. No, this is like deep, deep, deep. More than just a name. Does it have a name? Someone tell me if that feeling, that instinct has a feeling, right? Right now we just call it the golden hour. That's more of just like a policy, right? Or a standardized standard of care that we want to give. And I'm glad we do, right? I'll touch on the history of it in just a minute, but basically, because of these feelings, that is why we want to start preparing during our pregnancy, mentally, understanding what that time after birth may or may not look like, and accepting that those types of feelings are valid and should be explored to heal. So if you don't get this time and you're feeling a certain kind of way about it, talk to someone, right? Get a coach, like get me. I will take you as a client. We will talk through it during pregnancy and we will talk through it postpartum because I understand and you need someone that understands and will listen. So please message me if you're interested in becoming a client and having a nurse coach that gets this and can listen and walk you through it, or so if it's even deeper than that, then I will always refer my clients, if it's out of my scope, to a therapist, especially one that specializes in mental health of postpartum women, right? Because it is a special, special group of people that are feeling a whole type of way. And not just anyone can understand that and help you heal, right? Okay. So now let's move on. The benefits of skin-to-skin contact, I want you to know, don't end once that initial hour of period ends, right? So the word hour sort of gets to me because of this, right? It's like, hey, look, it's this super special 60-minute window you should have to gain all these benefits. And if you don't, well, that sucks. Even if you don't have even if you don't have your baby in that first hour, it's your pain and bleeding can be managed. You can successfully bond and connect and breastfeed your baby. And your baby will regulate their body systems and live a magical and happy life with you, even if you don't get that first 60 minutes. Wow, I promise. There's actually evidence that there is not as much quote unquote magic to that first hour as some of us in the birth world like to push. And that's why a stopwatch shouldn't be used. We use that 60 minutes because that's the time it takes for us to recover you more than anything, to make sure that, because that first hour is the greatest chance of you hemorrhaging and then us needing to step in as labor and delivery nurses, because we are highly specialized to manage that, even more so than postpartum nurses. And some postpartum nurses are labor and delivery nurses, so they will be able to manage it, but not at the extent that labor is. And we have if you've had an epidural, then we already have your epidural catheter in. We can run you to the OR if we need to. So that is a very special time more for you and your care and your assessments. So 60 minutes, I feel like they just give because, hey, that time period that we're with you in the L&D and you just gave birth to your baby, instead of us just messing around with mom and then taking baby and doing what we want and then bringing her, like, let's promote breastfeeding. Let's promote this bonding period. And that's why I believe it's 60 minutes. I couldn't actually find why it's 60 minutes and not longer, because what I did find, it's more like 3 hours or even 6 hours that you need to have uninterrupted time. So take that in mind, right? Like when you get to postpartum, that skin to skin and that golden hour time doesn't need to end. You continue it. And maybe you need to, once she goes to sleep and you wrap her up, I mean, you need to take a little nap. But when she wakes up, you can take a little, you can go right back to skin, right? We'll get into that a little more soon too, right? So there was a 2016 Cochrane review. So that's when they take a whole bunch of trials and studies and research, and then they give a review on it. And this was done about 8 years ago. It actually found no evidence of skin-to-skin contact immediately after birth was any different from skin-to-skin contact after the baby had been washed and examined first. Nor did that review or the existing scientific literature find that holding the baby skin to skin for under 60 minutes affected outcomes. So if you just get 30 minutes, right? You're like, I gotta sleep. It's gonna be okay. They didn't find anything negative happening from it, right? Maybe you got some positive things from it, but nothing bad's going to happen if you don't get it. Okay. So just take that in mind. Keep it there. Nothing bad is going to happen to your baby if you don't get it. You could benefit from it. There can be some improvements that they've found, but bad things could happen if you push yourself too hard during that time when you just needed to rest. And I'll touch on that in just a second. But before the golden hour became standard, so this is the little history, quick history. I know I love to go more into history, but I really just couldn't find much because one, they always performed, like there was no golden hour. It was just like back in the 1800s, early 1900s, even before that, they held the baby or they cleaned him up and gave him, and nobody was really studying it. So it was hard to find, but definitely once it got into the medical system, so in the 1920s to 1940s, they didn't allow dad in. It was very medical. You had your baby was born. They cleaned the baby up, swaddled him, gave him to mom. Congratulations. And that was that. And they're like, all right, we're going to give a bottle and then we'll move her to nursery so you can rest. And then they really took care of mom at that time, right? So most of the time, the babies were taken right away to do all the things that they had to do, including weighing and measuring and giving the bath and doing a full exam on them. And the mother was also generally in the labor room for about an hour before being transferred to postpartum care, like I said. So that switches charges from a labor unit and staffing to postpartum. So we're going to charge differently, which is why we only keep them for about an hour to 2 hours max before changing rooms, unless, of course, mom is having some difficulties and then she'll be kept longer. So honestly, taking the benefits that we found once we had all the research and using that hour instead of separating to clean and measure and do everything we need to do, and said, hey, let's instead wait and do those things later and give that time to mom and baby. And then we're going to call it the golden hour. Ah, so sweet. I love it. Golden hour, right? So that was really more of a push for hospital staff and nurses to understand, I think, why we want to do that. Golden hour, it's beautiful, let's do it. Because nurses at that time are just so used to taking baby, bathing, doing all the things they need to do, and moving them on to the postpartum unit. So it was more for nurses, like golden hour. And that's why they did the whole, it was like almost like a publicity or promo or whatever you want to call it, to get all the nurses on board. It's hard to change our habits and our ways and our practices. I think you've probably learned that more than anything in these episodes that I've been doing. It's hard to change. So I think the golden hours was way more for the staff and not so much for the moms, because like I said, moms and parents, they have an innate responsibility, and they're not in this system. They don't know what it's going to be like afterwards. And so then with that promotion, it's like, oh, okay, so during this hour, I'm going to get my baby, and these are the benefits of it, and everyone's on board. and it sounds beautiful and it's wonderful. It is beautiful. Excuse me. So we like to push it. We like to promote it. And yeah, most of the moms are like, yes, of course, I want that. How wonderful. I want a bond to be next to my baby. This could, though, with all this promotion and pushing, set us up for some mental anxiety, even anguish, you guys, and guilt, what I've seen when it doesn't happen. So let's talk a bit about these unrealistic expectations and they're realistic. Honestly, they're realistic expectations. But if you're in a place where it has to happen and you're so disappointed when it doesn't, then that's what I mean by unrealistic expectations. Like, it has to happen. And I think for the most part, we all understand that there are situations where we're not going to get it, right? But that doesn't really take away the disappointment or even the grief of not having, right? Because this idea of this time has been pushed and maybe even oversold, right? Now that you know that baby's going to be fine if you don't get it, why are they pushing so much? So if you only know one side, then you may not see the benefits of maybe waiting, right? So using words like magical and golden and setting the foundation, these are all things that I've mentioned when I myself have been teaching about the golden hour, or before I've studied it more, and working to have new parents achieve it. So then why else are we supposed to feel how else are we supposed to feel when they're not able to get it, right? So maybe it's a medical reason or a C-section or pain or exhaustion, to name just a few. Or maybe mom just isn't feeling it. I mean, maybe she's labored for like 50 hours, pushing for 2, without food or sleep. And then this baby comes out and it's bloody and it's not latching and there's just a disconnect, right? After all the hype, yeah, that can be definitely like lead to some guilt or shame. I had it with my first. I didn't even labor or push for that long, honestly. It was like 20 minutes. But it was 6 a.m. and I had 0 sleep that night because I was laboring all night. And she came out looking like an alien. Okay, looking all purple with this gross white stuff all over her. And they're like, "Yeah, here you go." I was like, "Yeah, good. No, I'm good, thanks." And then they took her, and this is of course 20 years ago, so there was little pushback. But I can only imagine if they did and they made me feel some type of way because I wasn't ready for all of that. I mean, I was 20 years old. I was totally inexperienced and unprepared. I mostly just watched that TLC, The Birth Story, where all the moms held their babies crying of joy and connection. And I was over here like, good Lord, no, I cannot. My legs were also like still in the air with people all around and the doctor in between my legs working on my vagina, repairing it from the episiotomy that he didn't even tell me he gave me, but that's for another day. No, I probably already talked to you guys about that, but then they gave me this like narcotic, this pain med that just kind of like put me out of it. I didn't even ask for that, but it must have been painful. You kind of black it all out, you guys. Like it's crazy. But anyway, so the problem of all of this hype and push arises when new moms feel as though they've missed out, right? They failed their baby, especially when maybe they just weren't feeling it. And that can happen for C-sections, of course, but also vaginal. What if they just want to speak to their own mother? Like, I just want to talk to my mom. Like, oh, this was crazy, and I need her in my room, or I need to call her, and I just can't handle connecting with this baby right now. The emotions and what you go through is so unique and individual, and it's all right? So would you rather maybe just sit up and eat something and have the baby cleaned up first before all that bonding happens? That's okay. That's okay. Like, you want this golden hour, I'm sure. And then maybe you pushed for hours, labored for days, or had a C-section. Birth can take a chaotic turn sometimes. And you may have sweat and blood and tears and amniotic fluid and puke all over you, right? Ugh. And then they put the sweet baby to your chest, but you're in a fog. You're disconnected. You're just not feeling well. Not exactly that sweet bonding experience that you were sold, right? So, to be clear, it's a nice thought, but birth can get crazy. And what you want to do after can change and be whatever you are able and willing to do at that time. You may hint to your nurse by asking if, hey, you want to weigh him? Or you'll just keep quiet and muster through because your nurse or family all want you to have that time. Even your doula, like if you have a doula, that she may push you just because she doesn't understand that it's just not going to work at that moment, right? And that's perfectly natural and common and okay. It may take someone stepping in to acknowledge your feelings or have intuition that you are not okay. And if it's difficult, and it may be difficult to speak up, right? You just don't know how you're going to feel afterwards until you're there. At least we can all agree, I think, that your mental health is a priority at that moment. And it's okay to be honest with yourself on what your needs are in that moment. And then you need to be supported. Most of the time I see this happen, and you know what, dads jump in so quickly and they remove their shirt and then they do skin to skin while I get mom more comfortable, even dim the lights and let her take a little nap after all that happened, right? Communication is key because not everyone is a mind reader like me. I promise you. I'm pretty good at this point reading a room and knowing how my mom's feeling and what she may want. I've been there in both occasions. With Kaya, I just was in a perfect place to bond and have that golden hour. And I was able to continue it in postpartum. And then I was perfectly fine swaddling her up and taking a nice nap after a good meal, of course. But it happened like that. And, 20 years ago, it didn't. Do I feel like I lost something? Not at the time. Maybe now I do because I'm more educated. But at the time, I was more like, why do I feel like crap? Like, I was more into like myself and why I felt so bad. Ended up I was hemorrhaging. I don't know. Did I tell this story already? I won't tell it today, but there were physiological reasons why I wasn't connecting and I didn't want to be with her. So just note that, okay? You don't push yourself. You do what you're able to do and maybe find out what's going on. What's the reason you're not connecting? Why I didn't want to breastfeed? Why I kept pushing her to go to the nursery? All of that, right? And I didn't communicate. I didn't know what I was feeling was not normal. So please communicate. Please speak up both before and during. It's learning to speak up and when you're able to have your voice, when you're able to voice what your needs and desires are, even if you don't know them, but you're like, I don't feel good. This doesn't feel normal and I don't know what it is. No matter what it looks like is so important, right? So have your preferences, have your ideal plan written out in your birth plan and use that to communicate. And then be open to like, hey, if I don't feel good, what are we going to do? Is someone going to step in? And your partner be like, yeah, hell yeah, I'll step in. I'll do skin to skin. No problemo. Love that. Right? And your doula is going to understand and your nurse is going to understand, right? You need to limit that pushback so that you can limit how much guilt you feel later that you're doing something wrong. And like I said, you may not ever be able to take away all of that guilt or shame or any of that because it's such a biological feeling, so deep rooted, but we can minimize it by educating ourselves on both sides of the spectrum, not just the benefits of golden hour, but why you may not want it in that time and that it's okay. Right? So have that discussion, create your birth plan around it, and they will know what signs to look for that you're not okay or that you're just not ready to bond, and then that's okay, and someone else can take over, right? There's really no wrong way for you to want to do things, no matter what your plan is. Just focus on your needs first. Maybe have your family like, hey, listen, you can wait in the birth room, in the waiting room. And when we're ready, we'll call you in. And that may not be 2 hours after, right? And they're just going to have to be okay with that. But let them know ahead of time. If it's not a discussion, then at that moment, they're not going to understand why you want them to not come in. They're going to be a little worried and scared. And all they want to do is see you because they love you, right? But have that talk. Everyone's different. Every family's different, right? And as practitioners, as educators and doulas, if you're listening, we may want to keep in mind that this practice is subjective. This policy and everything in labor and birth must be adjustable and fluid. Even the positive things that we want mom to have, it's not necessarily so healthy to push those things. We want to remember that even small details in a birth can put a heavy weight on mom and even dad or mom, the partners, the family during this emotional time. And, most of the mental health experts agree with me. We want to be able to accommodate hopes and preferences in the hospital. Of course, we do. And learning and educating on our policies that will give the most benefits to mom and baby, but that may also mean not following a standard such as the golden hour. There are very useful benefits to direct mom and baby contact that we've discussed and we understand. This undisrupted and uninterrupted right after birth for a significant amount of time, but not getting it does not mean that all hope is lost, right? So we want to value our mental health and how we work through our fears, hopes, and expectations. And how will we overcome feelings of shame and guilt and disappointment when what we had hoped for and expected are not achieved? Open ourselves up to the flow and nuances of birth and accept that our body and mind are allowing this for us. That will help you achieve your ultimate goals in birth and parenthood, right? So let's skip. I already discussed family. Even announcing, guys. So something we want, when you're discussing family, maybe with your partner, it doesn't necessarily have to be in your birth plan, but you want to talk about how you're going to announce this to your family. And for the love of all that is grand, please never send or post a photo without mom's total approval. Okay, that's just a PSA. Don't post mom and baby or announce it without mom's total approval first, please. That goes for anyone and everyone out there. You don't post on Instagram my niece is born. Sorry for my sister that's listening. Sorry, that was a little personal, but I still remember that. Anyways. All right, so we know the benefits of golden hour. You know what your own preferences are and what the dynamics are of your family and birth. You will be able to set those expectations and preferences for that special time, right? And then, so what about it being only an hour? Is it really only an hour? Okay, technically, the golden hour can last as long as the baby is not distressed, and it ends when the baby falls asleep after their first feeding. Okay, that's technically. It's the first hour or two because many babies, if done totally naturally, don't latch until the end of the first hour or even after. And then they feed and they suck for quite a bit. And that can definitely take longer than an hour. If your baby is feeding and your nurse is pushing you to get into your postpartum room, maybe they need your room for another laboring mom. I would definitely ask for more time, maybe another 30 minutes. And if it's not possible, just end it there and continue in postpartum as soon as you're settled. Your baby's going to understand, I promise you, and all will be well. So nowadays, hospitals and providers have shifted to promote breastfeeding and a less medicalized birth system. So those policies have shifted, and we can take up to 2 hours to recover you in a labor room to the extent possible. The general recommendation is that moms and new babies be kept together skin to skin. Most nurseries have also been done away with so that parents are in the room with the baby the entire stay at the hospital and never separated. Honestly, I had zero issue 20 years ago with them taking her to the nursery and letting me sleep. I won't lie. Even now, if I notice my mom struggling and exhausted, I'll ask her if she would like me to take her over to the nurse's station for a bit, and she happily allows me to. That just goes to show you that after birth, we need help. Since not all hospitals will even allow this, having someone in the room to quietly tend to the baby and let you sleep can be priceless. So use them. Both parents are encouraged to practice it with their baby. So this promotes bonding with dads as well, or partners. And it helps release oxytocin and those hormones for dad or for your partner that's going to bond them to the babies. But this won't just be for an hour, right? It's going to last weeks or even months. It's not just an hour, guys. It's way longer than that. So if you don't get that first hour, you and your baby will be okay and can pick up as soon as possible and take as long as you need. Months if you want to. So a little more on the details. A hat and diaper, a good idea, right? Once your baby's head is dry, you put a hat on just to help regulate and keep them warm. And definitely a warm blanket if you so choose. So, well, warm blanket, definitely. Hat and diaper, it's up to you. Mom and baby are covered with the blanket, and baby's head is remaining out. The baby's naked and not wrapped up. So maybe a diaper can be applied, or just like cover the bottom, because those first meconium poops are like sticky and can be explosive. So you may want to cover them up just to prevent any need for some serious cleaning. But all the necessary procedures and checks can be done while the baby is on mom. And take care to support the baby's head and allow the nostrils to be visible, and start noting signs of rooting or wanting to feed. And you don't have to push them to do it. Just love on them. Look them in the eyes. Speak to your baby. Feel her hands and her feet, and just connect naturally. It's going to come natural. You don't have to push yourself to want to feed right away. The baby's going to show you signs naturally. In fact, I want to go over the newborn itself, like what they do in the first hour. There's 9 instinctive stages after birth with mom, according to an article in the National Institute of Health. So this is a birth cry, relaxation, awakening, activity, rest, crawling, familiarization, suckling, and sleeping. I just did a post on this, so go to my Instagram at My Friend's a Nurse and look for it. I did it this week, but it's pretty cool. So the one is that birth cry. So that's the first cry that occurs almost immediately after birth. It can take up to a minute, and this is going to help the baby's lungs expand, and then they immediately relax. So the second one is they stop crying. The mouth doesn't really move, and the hands are super relaxed. So no gripping, nothing, just flap. They're like, what just happened? And then about 3 minutes after birth is awakening. So the baby starts to like thrust their head and shoulders a little bit, and opens his eyes, and then moves his mouth and just kind of rustles around, right? Then it gets even more. So number 4 is activity. So the mouth shows like little sucking movements that increases, and you'll start seeing rooting reflexes that become obvious. This doesn't mean they necessarily need to attach to your breast and want to feed right away. It's just these instincts, these reflexes that are starting because they smell you and they feel you. And these are things that are like, oh, I know how to do this. It starts maybe the activity around 8 minutes, right? Average, but usually around 8 minutes. Then after they do all these movements, like heavy movements, they could just rest. And they could rest at any point during this first hour where there's like, okay, I'm cool for a minute. Let me just zonk out real quick. Their eyes may close and they go back into a relaxed state, right? Then they get up. So around 35 minutes after birth, they start crawling, and this is those movements, moving their legs and their arms, and they're going to try to start finding your breast, and they're going to start moving. They're going to use up energy to get to your breast, and we call that like the breast crawl, which is pretty cool. And you can obviously help your baby at that time. So after they rested, now they're active, and then you notice they're like crawling, right? They're trying to get to your breast. Move them to your breast, but you don't necessarily have to like shove your breast nipple into their mouth at that time. Allow them to do number 7, which is familiarization. So they're going to start becoming acquainted with a mom's nipple by touching and massaging her breast with their little hands, and just, smelling and putting their mouth on it. They're not going to suck right away. So this can last like for 20 minutes, and they start maybe around 45 minutes, and they'll start doing this. And then 8, they're going to start sucking. So the newborn takes the nipple into their mouth, self-attaches and starts sucking. This early experience of learning to breastfeed usually begins about an hour after birth, right? So that's that golden hour. They're going to start getting on the breast. And it could take longer if the mom has had an epidural or any narcotics during labor. If she's had anesthesia or analgesia during her labor, the babies can come out a little more sleepy. So this may not all happen. Then they may need a little help getting attached, but or they may just want to sleep more. So just note that, and that's okay. They can do it when they wake up. And then after they suck for about 10, 20 minutes, then they're going to pass out. They're going to sleep. Sometimes mother as well. This is a great time to then swaddle her up or even have her on you, and they're going to fall asleep for about an hour and a half to 2 hours after birth. And yeah, at the end of the day, that's it. That's the 9 step, right? The 9 stages. And this happens naturally, and it happens about an hour. Oh, look at that. At the end of the day, I'm all about understanding the basics and why we do things, right? Both biologically, as a society, and as a culture. And in medicine is going to move the fastest, right? So the foundation of your care is the understanding of your own body, baby, and how it is meant to function. What is the process, and what are the most common things that could go wrong or in a different way, right? Once we have an understanding of that, it's going to be a pleasure when things occur, and we're not going to feel as bad if things, go a different direction. So yes, I really hope you enjoyed learning about the golden hour. I don't know what else to call it right now because I am kind of like, I don't know if I want to call it this anymore. If you know what we call it, I'm gonna do some more research on what maybe it's called. But it's just as a bonding time with mom and baby. And if you don't get it right away, remember you have you can do it later. You can do it when you get home. Do it in the NICU, whatever it is. So yeah, I just want to make sure you understand how to put it on your birth plan, how to communicate it with your whole team. And of course, if you want to work with me, you can find me at Colette@myfriendsandnurse.com. Send me an email, myfriendsandnurse.com, my website, to find out when my next workshop is or the childbirth classes. And I have a crash course coming up in November that I would love you guys to come to. That one I am charging because it's very important that you show up and you listen to it. So even if you can't come live, I just feel like when you pay for something, you'll actually do it. So it's for you. I'm charging you for you. But it's going to be great because I need to pull up the curtain of the hospital system for you to really understand. Because if you don't know, you just think the golden hour, that's standard of care, that's what's going to happen. How do you maneuver around it, right? And that's great for new expecting parents and as well as birth workers like doulas to really understand what to expect in the hospital so that you can pass along to your own clients, right? All right, guys, I hope you have a great week, and I'll see you next time. Bye. Okay, I hope you enjoyed this episode. I really did. I really loved researching a little more. I thought I knew the golden hour so well. I knew the benefits. I knew why we did it because the hospital pushes and pushes and makes sure that we know because it's such a big ship to turn all of these nurses to do a different type of care, especially after you deliver. We have a little laundry list of things that we need to do to get done before we transfer you to postpartum. And for them to tell us yeah, you can't do those things like you've always done them and you need to now give that time to mom and baby has been quite a change for us. So I think that's why, they named it what they did and they've really educated us on the benefits of this, including breastfeeding. We're so pro breastfeeding now in the hospitals, especially the baby-friendly hospitals. Maybe I'll get into that one day, what baby-friendly means, because it is something that you may not be aware of. But so we're very educated in this golden hour. But when I really dove into it and the mental health aspects of it and looking at both sides, right? That's what we need to do was pretty eye-opening for me, as is everything that I research and do around birth. I swear, I tell you, I learn something new every day. It's so true. And there's no way you're going to know everything about birth just during your pregnancy. So don't stress it. I'm glad you're listening and you're taking a bit of what I learned. And of course, if you want to work with me, you can find me Colette at My Friend's a Nurse. That's just email me, COLETTE. Or, find me on Instagram if you haven't already and get into my DMs and let's talk. I'm so open to it. I live in there. I love it when I can help out and talk to you. And if you want to work with me as a client, even better, because you really get as much knowledge as I can give you and set you up for a beautiful birth experience. So empowering. Being empowered is honestly the number one way to minimize trauma in a hospital birth. Okay. And that's why these hospital crash courses that I do, the next one is going to be November 2nd, 3rd, and 4th. And I hope you get into it. I hope you message me and go to my website, myfriendsnurse.com, and register for it now. It's going to be explosive. You're going to learn all the secrets. I'm going to open up that curtain and show you what you need to know. That is going to empower you. All right. I love all of the stuff that you can find on YouTube and social media and take those, classes that help your body prepare for birth, of course, and then help understand the process of labor and birth and both pathophysiologically and what happens to empower yourself and not relying so heavily on a medicalized system of interventions and medication and C-sections and all these things that we jump to in the hospital. You're going to be empowered that way. But if you don't also understand how the hospital works, taking those other classes, you're going to feel even more, less empowered. To assist in that, you have to understand how the hospital works. And that's why I want to focus on it right now and get you as a client. And if I can't get you as a client, then at least come to these classes and the workshops that I do monthly to just try to add to all the things that you're doing already. Okay. So, because man, a hospital is Goliath. All right. And I need to help you. I need to give you the right tool to be able to stand up and find your voice. So, okay, this episode is long enough, so I won't go on anymore. But the next series of the first 15, I'm going to start focusing on the medication. So there'll be 2 different episodes where I go into the vitamin K injection and also the erythromycin. That's the ointment that we put in the baby's eyes. Very important to understand and make a decision on before you get to the hospital. So let's dive into that next time. For the next episode, I'm going to welcome Soshi from the Family Tree Wellness in Los Angeles. And she focuses on women in the pregnancy and postpartum time. Such a critical time in our lives where things are just changing our body, our spirit, who we are as a person, and hormonally, emotionally, this matrix that we're going to go through during that period, all the ups and downs, how much help we need, what to look for when it comes to postpartum depression, OCD, anxiety, mood disorders, anything, postpartum blues. How can we help ourselves? How can we find the right resources and what we need to look for early on to know if we're more at risk? So definitely join me next week to speak with Sis Soshi. She's just freaking lovely, and I had such a great time talking to her. And then the following week, we will continue with the baby medications. So until then, have a great, great week, you guys. Bye. Thank you for listening to My Friend's a Nurse presents the Birthling Podcast. We hope you enjoyed today's episode and found it valuable. Before we go, a quick reminder. The information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please subscribe, leave a review, and share it with your friends. Your support helps us reach more people and continue to bring you great content. Until next time, stay healthy and stay informed.